stop. Before you go for that induction, you're going to want to watch this video because you might be falling into the induction trap, which is one of the natural birth traps on my list that basically sabotages your natural birth, undermines your confidence, and leads to unnecessary interventions, including, if you're not careful, a C-section. Hi, my name is Carly Bonderud, and this is the Empowered Birth Series, where I go deep into everything that you need to know to plan and get your empowered, true natural birth. And today we are talking induction. If you've been following along with this series, then you know that we're going into the 20 natural birth traps that you want to avoid if your plan is to have a natural birth as natural as possible, also known as the true natural birth or physiological birth. What are the natural birth traps? Well, if you are new to me and you've just stumbled upon this video, let me just tell you, the natural birth traps are exactly what they sound like, a trap. Now, you can learn more about this inside Chapter 1 of my book, Your Empowered Birth, or by watching some of the other videos. You can also check out my website, empoweringmomsbirth.com/start guide to really get the idea of what a natural birth trap is and why you want to avoid it. But here's the short version. A natural birth trap is basically something within our society or our birth culture or within medical practice that you think is normal and is going to help you have a natural birth. But then what happens is because the medical system and our birth culture has perpetuated the term natural birth, you don't actually know what you're doing. In the case of induction, this is not natural. I don't care if you've had a whole bunch of natural means to try to get into labor. The natural process of birth, the true natural birth, is a physiological process that your body is going to do, whether you do something on the outside or not. But if you tamper with that process, that is basically the equivalent of trying to get a bud of a flower to bloom before it's ready, or picking fruit off of a vine before it's ready to ripen. You don't want to do this. Unfortunately, we have an epidemic right now in our society where pretty much every mom is being induced. In fact, recently, Dawn Thompson even spoke on this at a convention where she said that almost 41% of the births of first-time moms are induced, and that is an underreported amount. So when I learned that, I wasn't actually surprised by this, because when I became a birth advocate way back in 2014, I had already found out that our local hospital had the highest induction rate in the entire province. And then not only that, that was the highest induction rate in the country. It was horrible to discover that almost 50% of the moms were going in and they were getting induced, or they otherwise felt that they had to speed things along, get things going. Go check out some of my other videos about why you don't want to push on the outside and why you don't really want to be pressured into an induction. This includes membrane sweeps. This includes castor oil, which I've also spoken on. And this includes all the other natural induction methods. But mostly, it also includes Pitocin, which is the most common method of induction, is running Pitocin. Again, I'm going to be covering all of this inside of this masterclass. So if you are new to me, then you're going to want to know how this works, okay? So I have 3 paths within the empowered birth method for you to basically get the birth you want without having to fight, beg, or compromise. And part of the empowered birth method is that we aim for a true natural birth and we pull back only as much as needed. The reason for this is because you are far less likely to have complications, far less likely to have trauma, and far less likely to have unnecessary pain during your birth if you are following the physiological birth model. If, however, you are following the natural birth tips that are out there, and you're pushing mostly on the outside, or you're maybe agreeing to interventions to try to avoid a C-section because your care provider is saying induction is better than a C-section, what this does is it causes you to fall into that natural birth trap I mentioned, which then leads to you wondering, what did I do wrong? Well, it's not really you. You see, we live in this birth culture of fear, And we also haven't really been taught what physiological birth looks like. A lot of doctors haven't even seen it. Even midwives are not immune. So you might want to check out some of the other videos in this series, especially since, as I said, there are 3 paths to the empowered birth method. Number 3 is premium coaching, which is when I take my clients and I basically work with them. I also do 15-minute laser coaching calls. However, there is a caveat to that. I don't work with everyone who comes to me, and you really need to be at that level where you're coachable, you're able to afford it, and it's not going to be like between that or a bag of groceries. Because you know what? I am committed to you having an empowered birth, whether you work with me or not. So the other path that I have is self-study, and I'll talk more about these paths deeper into this masterclass. So stay tuned to the end. But the final path, the number 1 on the list, is the do-it-yourself path. That is basically what these deep dive masterclasses are. I want you to go through them as if you had actually paid me money to take a course with me or to take one of my classes and learn from me directly. That means I want to make sure that you are in a place where you can sit down for about an hour or a little bit longer to take notes, to really absorb this education, and to also utilize the rule of 3. Watch it once, get the overview. Watch it twice, get the aha moments and more clarity. And watch it for the 3rd time, and then suddenly you're ready to implement because you've got it. The other thing I'm going to mention is that I put transcripts inside of the descriptions of these videos. Now, I can't guarantee that our technology is always going to work properly. Sometimes the transcription software malfunctions. So if there is no transcript currently, it will be available later. You can always just keep checking back. Or if you want to know the fast track, you can subscribe to the newsletter, which you either go and get one of our self-study courses, or you can go and get the Empowered Birth Toolkit. This toolkit comes with workbooks that you're going to want to also take advantage of, because everything with empowering moms, the deeper you go, the more treasures you uncover. And as I said, I'm committed to you having an empowered birth. The problem with induction is that there's a lot of fear around it, and I'm going to do my best within this masterclass and within the transcript itself when it becomes available for you to basically debunk these myths for you and help you feel more confident in either declining an induction or choosing it if it really is the right thing for you. And the way that these are structured is basically you are going to want to take advantage of that rule of 3 and go and get that transcript. As soon as it is available, make sure you get it. It's in the description of this video. Okay, so now that you understand how you're going to get the most out of this masterclass, especially if you're doing the do-it-yourself path, the next step is to understand how these classes are structured, especially if you like to skip around. Hey, I'm not going to get mad at you if you need to just skip to a point where you're really curious. And that's why I do have the transcripts as well. Until the actual PDF transcript is available, even if it is right now, what you can do, you can go in the description, and YouTube also generates transcripts. But, you know, they sometimes mess up things because it's not perfect. Nobody is editing it. It's just an AI. So you may not get as much out of it if you do it that way as you would if you had the traditional transcript with the bold text and the links, because I embed links into these transcripts. However, the whole structure of this class is like this. First, I'm going to tell you a story. Then what I'm going to do is I'm going to tell you how this is a trap, how it undermines your confidence, how it leads to unnecessary intervention, and a little bit about how induction sabotages the physiological birth process. Then what I'm going to do is give you a few additional tips on how to consider induction and when to actually say yes to it. And I will also reference some other resources that you're going to want to get. I will tell you how to apply this with the empowered birth method to either say yes or say no to induction. And I will tell you more about how to go deeper with this, because, you know, induction is one of those topics that I cover quite a bit. In fact, around certain times of year, we have something called induction season. There's one in the summertime and there is one in the wintertime around the holidays. So anywhere from the end of October all the way to the first week of January is the biggest induction season. This is when moms mostly get pushed into induction and it's handed out like Halloween candy or candy canes. And I'm constantly trying to combat this. But as I said, there's a lot of fear. So I'm going to show you with the empowered birth method how you can say no to induction. And then after that, we'll just quickly recap. I'll tell you the highlights of this masterclass. So if you did miss anything, you can go back into your notes and add it. And then we finish off and I tell you what's next in the series. Sound good? Okay. So I'm going to share a story with you because, I find that teaching through story actually helps you retain things better. And it's a story of two moms again. I was never induced because I refused to be induced. When I was 35 weeks along, they told me that my baby was too small. Now, this is one of the reasons why induction is often offered is because the doctor will say that the baby is too small and not growing properly, and moms typically start panicking. And they're like, I wanted a natural birth, and now they're saying I have to induce. And this is when my spidey senses tingle. And I'm like, no. Before you even say yes to that, you need to know the difference between small for gestational age versus a true growth restriction on a baby, because they tried to get me for that too. However, I was so against induction, and I did not defer to authority very well. And I had critical thinking skills, and I didn't trust the system. So I was so determined to avoid that induction that I started to basically make concessions. Now, you don't have to make concessions, but if you want to for your own sanity or just to reassure yourself, you can. So I went for ultrasounds biweekly, and I also went for twice weekly non-stress tests. And I had made the decision privately to myself that unless there was actually a problem, unless they could prove that my son was actually in any danger, I was going to let him cook as long as he needed to, because I had seen it as I'm a tiny person, so it makes sense that my babies wouldn't get too big right away. And, they're on their own growth curve, so I have no reason to induce. Thankfully, because of my determination not to induce, at 39 weeks, my midwife had called me up and she said, I'm sorry, that ultrasound was very badly done. And your growth has been normal, and there's no reason why you should have been told that you couldn't have your home birth. Let's plan it. But I was scared by that point because I had been told for several weeks that my son wouldn't tolerate labor very well. So, if you don't have your confidence and you don't know how to get out of fear traps, this can also derail your birth, even if you don't choose to do induction. Because if you're planning a home birth and suddenly they tell you that your baby is too small or your baby is too big, which is another one, or you go overdue, then what this does is it puts unnecessary fear into your head, and it can be really hard to get out of that. But with the empowered birth method, I have basically perfected this system so that if you have all 5 pillars, then you can't be tricked. And you can check out some of my other videos as well on how to confidently say no. So in the end, I didn't get induced, and I had my baby at 41 weeks, and it turns out that too small baby was almost 8 pounds. Could you imagine what would have happened if I had agreed to that induction because he wasn't growing properly at 39 weeks when he was just starting to catch up? Because that is the week when all of my stretch marks appeared. I had gone through my entire pregnancy, not a single stretch mark, and I thought I was so awesome. And I'm like, oh, I guess I'm not going to get any stretch marks. Guess again. They all popped up at 39 weeks. He just shot up in growth, and it's like, oh, that's awesome. Yay. But they were all underneath my belly button too. So, understanding that babies are on their own growth curve. You also need to understand about my friend Christine, who had basically gone past her due date. You can check out her entire story within the Positive Birth Stories because she did go on to have a unplanned home birth after cesarean. I also talk about this inside of other master classes and inside of Your Empowered Birth, that little blue book behind me. I mean, Christine really showed me just how many loopholes were in the system and that even a VBAC mom could have a home birth. It just took a little bit more clever planning. And she had basically been traumatized after her induction. So, if you understand Christine's story, she had gone to 42 weeks and she was told she was going to lose her midwife if she didn't induce. Christine induced. She ended up with a very traumatic C-section. Her baby was only 6 pounds. So, how fair is that, right? So, understanding that babies are all different sizes at different weeks. Just because you go to 42 weeks does not mean that you are going to have a massively big baby. But even if you did, that still doesn't mean that you can't have a completely natural birth, because I've had other clients and people I know who have had 10-pound and 11-pound babies at home and not had a single tear. And the reason for that, again, is because physiological birth is different from medically managed birth. So then we also finally have Jenny. I mean, Jenny was the high-risk mom. She was the epitome of the high-risk mom. Chronic high blood pressure, gestational diabetes, GBS positive, postpartum preeclampsia with her first baby, and she had had one traumatic C-section. She was also 41 years old. So she had all of these risk factors, and Jenny had still decided she was not inducing. Again, Jenny's story is one that I tell quite often. So you can always check out my book, Your Empowered Birth, or check out the interviews where I've basically interviewed Jenny. It's also on my start guide in the success stories, because again, Jenny's story is just so inspirational. Because if a high risk mom who is 41 years old and had preeclampsia with her previous pregnancy can go on and have a completely unassisted vaginal birth in the hospital, then, there's just so many more options and possibilities, right? So, what do these three stories basically tell you? Well, first of all, it tells you that just because somebody says that your baby is too small, that doesn't necessarily mean it's true. Just because they say your baby is big, it doesn't necessarily mean it's true. And just because you go overdue doesn't necessarily mean that you need to induce. And just because you're high risk doesn't necessarily mean that you can't have a completely natural birth and avoid the induction. So, the other thing I'm going to basically say is that Jenny did have a backup plan for induction, and she used a lot of the resources that I'm going to be mentioning in this video. In fact, Jenny had basically come to me after her traumatic birth. I had found her in a local mom group, and she said, I was traumatized at this hospital and I need to vent. And I'm like, oh, well, I've already been in these groups, and I know that the second you say anything bad about this hospital, they're going to come down on you, because these moms have been so traumatized and internalized their trauma that they don't actually want to look at it. And then there's the nurses that try to defend it, and they're not helping things either. In fact, a few months before that, I had been collecting birth stories to basically highlight the trauma in our medical system, and people had come down on me, but a lot of moms had reached out and they did ask to be featured in my blog at the time. So I reached out to Jenny and I sent her a message and I said, hey, you don't want to be venting in here. Come over here where it's safer. And I told her basically that our induction rate was insane and that there was no reason for it. And that even if she had happened to have risk factors to induce, she did not get informed consent. And I also told her about the fact that she had been aiming for a natural birth. So she had a natural birth plan, but she was choosing induction. You can't use a natural birth plan with induction. It's completely different. And she's like, why did nobody tell me this? And I'm like, well, most people don't really go that deep. Like, did you have a doula? And she's like, yeah, but my doula didn't seem to know as much. And I'm like, yeah, they tend not to know very much, or they're not aware of just what this hospital does. And she's like, well, how do I take your classes? And I didn't have any at that time. I was just writing a mom blog. I was just out there as an advocate speaking on this. And I'd been doing that for several years. But Jenny is the one who basically said, how do I take your classes? And that is why the Empowered Birth series exists, because I don't do a lot of one-to-one or live classes anymore. I'm very protective of my time. That is within path number 3. And as I said, I don't work with everyone. So you are going to want to take notes at this point, because now I'm going to go into how this is a trap. Okay, so induction is an absolute 100% natural birth trap. The second you choose induction, you are no longer having a natural birth. I repeat, you are no longer having a natural birth. So when moms go into the mom groups and they say, I have to induce, how do I still have a natural birth? You can't. It won't work, because the definition of an actual physiological birth is no intervention. That is the definition. The second you interfere with nature, you are no longer having a natural birth. This is not a judgment. This is not saying that induction is worse than having a physiological birth. This is not saying that it's not right for you, but you need to go in with the reality of knowing that this is not going to be natural. You can do it unmedicated. I have talked to moms who have had inductions and gone unmedicated, and then they've decided that they want to have a home birth, and they say, contractions were so painful, I don't know if I'm going to be able to do it again at home. And I look at them and I'm like, you were induced though, right? And she's like, yeah. And it's like, so you don't actually know about physiological birth contractions. They're going to be so much easier. You're probably going to just call the midwife at the last minute, because you're going to go through and think that it's a walk in the park. And this actually happened with Christine, is because she had been induced with her first baby. She had been like, oh, this is a simple thing. Like, I don't feel very badly about anything. Like, I can walk, I can talk. They're not one on top of the other. And she had even been texting within our little group that we had, because we were all rally coordinators. And she had been saying, oh, yeah, I think the baby might come like maybe tomorrow. Like, I'm in early labor. And I didn't think anything of this either. So I'm like, okay, yeah, maybe it's early labor. But her experience of the contractions was different than mine, because I have only ever had spontaneous labors. She did not. So when she was saying, oh, they're this close and they're this intense, I'm like, oh, okay, so that's basically me the night before my daughter was born. No, because when they suddenly started to get very intense, that is when Christine was like, okay, I think I'm ready to head out to the hospital. And her waters had released. And then she ended up having the baby at home. She called the midwife. The midwife is like, we still have time to transfer to the hospital. Christine's like, do I have to get on the bed? And the midwife's like, well, yeah, it's the policy. You'd have to get on the bed for transport. And she's like, then I'm not moving. And they sent the ambulance attendant away. And Christine had her unplanned home birth after cesarean. So understanding that if you have been induced before, you don't know that physiological birth contractions are actually not as painful. So when you understand that, how this undermines your confidence is that if you are being induced, first of all, you think that you don't go into labor on your own. You may also not dilate. And that is because your body is not really meant to do this right now. It's not supposed to be going into labor. They are pushing on the outside for something that your baby actually initiates. So your baby has a protein in their lungs that develops at the very end after they're ready to be born. If that protein, surfactant, is not present, that means that the baby is not ready, which means your body is not ready. Also, you need to understand that your cervix is not a crystal ball. Just because it starts to dilate doesn't mean that it's going to stay dilated. It might close up again if you are afraid. And, a lot of times inductions don't work. If you are a first-time mom, especially, and you induce, you are 3 times more likely to end up having a cesarean than if you have already had 1 or more vaginal births and induced then. So understanding that this is not a gentle process, and no matter what method they use, if your body is not ready, if your baby is not ready, then you are less likely to dilate at the level that they want you to, which means that they're going to up the Pitocin or do other things that are going to lead to you basically having the interventions. We'll get to that in a minute. So your confidence is undermined. I don't go into labor on my own. I don't dilate. I can't give birth to my baby. I can't handle the pain. And therefore, I'm just not able to birth naturally, is what usually happens. There are so many stories out there of moms who will say that natural birth was traumatic and painful, only to leave out the part, and I find this out later, that they were induced. The second I see that and they say natural birth traumatized me, and I realize, no, you were induced. Of course, it would be traumatizing. Induction is not gentle. That basically is perpetuated in our birth culture and led to that fear. And as I mentioned, we have an induction epidemic. In fact, recently I was in a local mom group, and as I said, this hospital happens to have a very, very high induction rate and a high C-section rate. We're talking about 46% C-section rate right now, currently. And I'm looking at that, and this mom is saying, well, they're saying my baby's big, and so they're going to push an induction for 39 weeks. And I'm looking for positive stories because I really wanted to go natural. And I'm like, red flag. What do you mean you need to induce? No, 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 no. It's the weekend, and a long weekend at that. It's a holiday for our community. So, of course, they're going to push induction. I'm not surprised by this. And they're saying it's because your baby is big. Now, everybody else is trying to explain to you that that is not evidence to induce. And you're still not listening to it because you're a first-time mom and you're scared. But what she said also shocked me because she told me, well, my doctor says that most first-time moms get induced now. It's just normal. And I'm sitting there looking at that. I'm like, what do you mean first-time moms are automatically getting induced? Are you telling me that this is the justification and you're going to go along with that? That's as ridiculous as when the midwife had gaslit me and told me, well, most first-time moms transfer anyway, so you might as well just have a hospital birth. So the undermining of your confidence is a big one. You cannot discount that. This is why you need to be following the empowered birth method and getting past your fear. Because if your confidence is undermined, then they are going to push more intervention during your induction, especially since induction often it doesn't go the way that they expect it to. You can have more complications. First of all, with induction, you are more likely that you're going to have the IV for fluids. The reason for that is because they are going to be using the Pitocin drip and they're going to want to add more medication. They also need access to your veins in case something goes wrong. First of all, induction carries a lot of risks. So if they are not monitoring you and your baby and they're not having access to an open vein, yes, it's more likely that you could hemorrhage or something could go wrong. The other thing, of course, as I mentioned, you'll be more likely to have continuous fetal monitoring. This is another natural birth trap in itself. However, when you are inducing, you are having contractions that are longer, stronger, closer together than they otherwise would have been if you were following a spontaneous labor process. So they need to monitor your baby to make sure that they're not going into distress. They may also break your waters. Now, the reason they do this, as Rachel Reed talks about inside of her book, Why Induction Matters, is that Pitocin use and induction can lead to a amniotic fluid embolism. Basically, the force of the contractions can push amniotic fluid in places it's not supposed to be. And if that happens, it is dangerous. So, like, that is a major emergency crash C-section, try to save you and the baby situation. So, when those contractions are getting to a point that they wouldn't be that intense in nature and that strong, this can also lead to a uterine rupture, even if you've never had a C-section. So these are rare complications, and they are more likely to happen with induction. So you need to be aware of that. If your care provider is not citing these risks to you, when they're also citing the risks of staying pregnant, then they are not giving you true informed consent. So you recognize that you're likely to have an IV, you're likely to have continuous monitoring. You're also more likely to have vaginal exams because now they need to be able to assess where you are in the process of induction. If induction is not working and your waters are still intact and you and baby are still doing fine, you can stop the process. You can choose to stop the process. If, however, they have broken your waters as part of their induction method, then you are now on borrowed time because your baby does not have that cushion of fluid and your body wasn't expecting that fluid to be gone. So understanding that the more you tamper with the physiological process, the more likely it is that you are going to have more interventions done to you. And this is again because induction in itself is dangerous. It is a dangerous thing to do because you are messing with nature. This is why it should not be done as an elective thing for just any arbitrary risk factor, but be weighed against the risks of staying pregnant versus the risks of induction. If they're not telling you that, you're not getting true informed consent. You need to understand that. The other thing is if you manage to avoid a C-section, because a C-section, as I said, is more likely with an induction, you are more likely to have a vacuum assisted or forceps assisted delivery because baby may get stuck. You're more likely to have an episiotomy. You're more likely to have severe tearing because the force of the contractions pushing the baby down will not allow your body to stretch and adjust. And you're more likely to have the epidural because those contractions with Pitocin are not fun. I do not suggest Pitocin. It is like the worst. The only time you want to use that is if you have made an informed decision and you're like, this is probably going to help me to get this baby out faster because I've got some sort of other issue that I'm trying to avoid. But Pitocin is, again, a dangerous drug. I'm not going to sit here and sugarcoat it and tell you that it's not, because it is. I'm also not going to sit here and tell you that physiological birth is the only way to birth and that interventions can never be done or that induction is terrible. No, sometimes if you have preeclampsia or you have other complications that warrant an induction for your own safety and for your baby, that is appropriate. But there is a huge difference between a complication, a variation, and a deviation. And you need to understand that. You can go and check out one of my other videos where I talk about assessing risk because I can't get into it here. This masterclass would end up being 2 hours long if I did. But understanding that not everything that they push induction on you for is actually going to mitigate your risks. And Hensi Goer also talks about this inside of her book, Labor Induction, Why, When, and How. So understanding that part, that you're going to have that cascade of interventions, how this interferes with your physiological birth process. Well, if we look at how birth physiology works, and again, you can learn more about this inside of Rachel Reed's book, Why Induction Matters. Hensi Goer also talks about this inside of Labor Induction, Why, When, and How. What you need to understand is that your body is designed to go into labor on its own. It will happen. Whether it happens on the timeline of the medical system is a completely different story. Go check out some of my other master classes on due dates for more on that. The other thing you need to understand is that your body is already preparing for labor. So you don't need to have cervix checks to check to see how dilated you are. You can actually reverse progress if you do that, because your body is designed to basically need to feel safe in order to give birth and to go into labor. So if you have a lot of stress, this is more likely to pump adrenaline and cortisol through your system, which blocks oxytocin. But physiologically, what happens at the end of pregnancy is that your uterus that didn't have very many oxytocin receptors suddenly gets those receptors, which means that those practice contractions that you had at the beginning might start to feel more uncomfortable because they're actually doing something. It's building up. It's basically priming that muscle, the uterus, to develop the strength to do the contractions. It's warming up, is what's happening. The other thing you need to understand is that the cervix is pointed at the very back. So you can't reach it easily. And the reason for that is because if the cervix was lined up with the birth canal the whole pregnancy, it would naturally start to open because you've got 7 to 8 pounds of baby on top of it. So your cervix is pointed to the back. Your cervix is also very hard, like the tip of your nose, and then it softens more as you get closer to labor to be like the texture of your lips. And then it will start to open slowly. But the reason why you don't want to mess with that process again is if you start flooding your body with adrenaline and cortisol, then you're basically telling your body, hey, it's not safe for us to go into labor. Let's delay this until we can get to our safe cave. And many moms get this wrong. They think that those practice contractions or dilation means that they are going to go into labor soon. If they are even starting to feel a lot of discomfort, they go to the hospital and then they're told that they're stuck at 2 centimeters. They're wondering, why is this so painful if I'm only stuck at 2 centimeters? Well, there's a lot of reasons. Maybe baby is not in the right position, in which case do not let anybody strip your membranes because they could accidentally break your water or accidentally do it to get things going. And, the other one is that maybe your perception of pain is based on the fact that you keep tensing up during those contractions instead of letting them ease off. And maybe it's because you're doing all of the things. So you're tiring your body out. And so your body is basically signaling you stronger and stronger to be like, hey, rest, stop it. Oh, that one wasn't strong enough to get you to lay down. Well, now I'm going to give you another one. So you think that you're in active labor, but really you're not. So physiologically, if you are going into labor on your own, your baby's lungs are ready, your baby's nervous system is ready, your baby's digestive system is ready. Your cervix is doing what it needs to do. It's starting to open up. You are also being able to loosen up more. Baby is turning in the right position. You mess with that with the induction process, and none of those things have likely happened yet. So baby could end up having respiratory issues. They could have difficulty breastfeeding. They could be really cranky and colicky because their nervous system hasn't caught up. You may have problems dilating because your cervix was not actually softened enough to be able to do that process. And how it affects the contractions is that instead of your body basically adjusting as it needs to, because contractions in a physiological labor do not follow a typical pattern. They follow the pattern of what is needed in the moment to shift baby into position, to build up the fundus on the uterus, to basically just open your cervix, to push the baby down, whatever it needs to do. And it's not going to overwhelm your system because of this biofeedback that happens. So the contraction happens and it squeezes the baby inside of the amniotic sac. And the baby doesn't like that one because they're maybe in a position where it's compressing on the placenta. And so the uterus is like, oh, okay, we need to adjust this so that baby can get more oxygen. So we're going to space these contractions out, or we're not going to have them as strong, or we're not going to have them as long. And while this is happening, your body is also being flooded with endorphins and oxytocin is flowing. So, like when you are getting pretty wild with your partner at certain times of the month, even, and you don't feel pain as much. In fact, there's a wisdom that you don't want to go for certain procedures like a bikini wax or even dental work or anything at certain times of your cycle because you're going to feel more pain than at other times when your body is flooded with different hormones. So the same thing is happening in birth and labor is that your body is flooded with these endorphins. You are not going to feel pain as much as if you didn't have any of those endorphins and didn't have any of that oxytocin flowing. Okay? Remember what I said about stress, and remember what I said about cortisol and adrenaline blocking oxytocin, and it's blocking those endorphins as well. So the reason why this happens, again, is because you are supposed to go into a labor trance. You are not supposed to be thinking when you are in labor. You are meant to go into a psychedelic labor land, as one of my former clients has called this. And in psychedelic labor land, you don't feel as much pain. Go and check out some of my other videos where I talk deeper about this as well. I do talk more about true natural birth and the things you need to understand. But if you're not in psychedelic labor land, because you have got synthetic oxytocin, that blocks the blood-brain barrier, which means there is no biofeedback happening, which means the uterus is hyperstimulated. And that means that the baby cannot tell your uterus, hey, stop. The uterus is like, I can't stop. I don't know what happened. As one of my dear friends, Samantha, who has also done an interview on Pitocin and induction, you can go and check out either the transcript if it's available at the present moment, and I have that link in there, or you can go into the playlist where I have the interviews. She talks about this as essentially you're driving a car without a steering wheel and you've got the brick on the gas pedal. So you're just expecting the car to just go to its destination. It's not going to work. It's more likely to slam into a tree. So this is why we then have a lot of fetal distress happening. This is why they say the baby's not getting enough oxygen. And then they take you in for that emergency C-section. And it's like, oh, thank goodness my baby is okay. They saved my baby. No, you had an induction. And the Pitocin probably upset your body to the point where things just were not going to progress. And it was very painful and it traumatized you. And it also caused problems for your baby. And I'm not going to even sugarcoat that. Induction is incredibly risky, especially if you don't need one. And there are so many induction traps that I couldn't possibly list them all. But if you have my book, Your Empowered Birth, or you have my course, Your Empowered Birth Academy, then there is a mini guide that comes with both of those. So with Your Empowered Birth, it's within the extras. You just put in your name and email and you get that package. With Your Empowered Birth workshop, all you do is you put your name and email in and you get that course and all of the guides that come with it. And one of them is the Induction Traps Guide that tells you the 10 reasons why you don't want to induce, and you learn more about those traps. I will also be doing a series in the future on the list of induction traps and probably going deeper into them. But what you really need to understand, as I said, is that if you fall into the induction trap, you are no longer having a physiological birth. Okay, so when do you want to consider induction before we get into the empowered birth method? Because there are times when you want to actually consider it. And I kind of hinted that you want to assess based on risk factors and what you are really comfortable with. You know, two people can get the same stats and they are still likely to make different choices. If a care provider has a lot of clients and they are all making the exact same decision, that care provider needs to be reassessing just how are they presenting informed consent, because two people can look at the same stats and make completely different choices. If they're all making the same, there might be something there. Okay, so you want to be very careful about that. You are your own best expert. Please do not go into the mom groups and say, I have such and such complication or such and such variation, and they're pushing induction. What do you suggest I do? No, because they are basing it on their idea of what they would do with their comfort level for their level of risk. And that is not your map. Okay, so you need to understand that. For Jenny, it did not make sense for her to induce. She had a very thorough backup plan. She had her main plan, aiming for a true natural birth. And then she had several different methods of how she would go about induction if certain flags came up, because she was very concerned about her chronic high blood pressure and how that might affect her pregnancy. And she also wanted to avoid preeclampsia. She did have an induction plan. She just didn't have to use it. She did have a cesarean plan. She just didn't have to use it. So the time to create your backup plans and your birth plan is actually at the beginning of your pregnancy. That's another thing that I talk about as part of the empowered birth method, because then you're able to hire the right care provider for you. And I'm going to go into this deeper. The other thing you need to recognize is that there is a lot of information out there. There's research, but research has limitations. And both Hensi Goer and Rachel Reed talk about those limitations. Dr. Sarah Wickham also talks about this. So before we get into how to apply the empowered birth method to either saying yes to induction or choosing not to have an induction or creating a backup plan, I'm just going to go into these resources. So the first one I've mentioned several times is Why Induction Matters by Rachel Reed. This is probably the first resource that I had in my collection for induction. And up until the point when Hensi Goer put out her book recently, as of just recording this video, it came out last week. She basically goes deeper than Rachel Reed does, but Rachel Reed has a lot of things that Hensi Goer's book does not. So Rachel Reed goes into research, as does Hensi Goer. However, where they're different is that Rachel Reed also covers a lot more of the risk factors and variations of pregnancy and complications of pregnancy that Hensi Goer does not cover inside of her book. So Why Induction Matters covers a lot of complications, including cholestasis, including type 1 diabetes and how that differs from gestational diabetes. She covers a little bit on stillbirth. She covers a whole section on IUGR, intrauterine growth restriction, versus small for gestational age, which when I was reading it way back in 2018, I was absolutely devastated and livid because I had not been given any of that information. If I had been given that information, I never would have felt that anxiety for the rest of my pregnancy, thinking that there was something going wrong with my baby. There's also some other complications that she talks about as well, such as preterm rupture of membranes. So this is before 37 weeks. And then within the variations, she talks about pre-labor rupture of membranes. She talks about twins. She talks about VBAC. and she talks about advanced maternal age and going past your due date. She also goes into the details of spontaneous labor going past your due date versus actually just inducing at a certain point. She doesn't go very, very deep into the Arrive trial because that kind of came out around the same time of her book, but now we have more information on it. Hency Goer's book, Labor Induction, Why, When, and How, does. So if I had a copy of Hency Goer's book in physical form, I would be holding it up for you. It's a little blue book, and it's part of her Take Charge of Birth series. As of recording this video, though, I have only been able to order this on Amazon, and it's not coming until later in the week. I received an advanced copy from Hency Goer herself to basically review last month. And what I can tell you is that this is an excellent resource to learn from, especially if you are trying to make decisions around induction. Rachel Reed also has an induction plan, a positive induction plan. Hency Goer's also got one inside Labor Induction, Why, When, and How. So for the best results, I would suggest if you're going to make decisions on induction, then you would probably benefit the most from getting both a copy of Why Induction Matters and Hency Goer's book, Labor Induction, Why, When, and How. If you really like the nitty-gritty numbers and you really love to dive into research and you aren't overwhelmed by a lot of clinical terms, then In Your Own Time by Dr. Sarah Wickham is another book that I would recommend. Now, again, this is a very dense book. So if you like something that's more surface level, or you really appreciate the way I wrote out Your Empowered Birth, or how I basically write out all of my written material because it's easy to understand and you don't have to have a lot of brain power to get through it, then this book probably is better to have as a reference rather than to read it cover to cover. You can flip through it and you can get whatever you're curious about. Now, as someone who is deep into the birth community and someone who routinely supports moms who want to avoid induction or were induced last time, had traumatic C-sections, and want to know what happened to them, I do collect a lot of induction books. And as I said, those are the three I would recommend. So In Your Own Time by Dr. Sarah Wickham, Why Induction Matters by Dr. Rachel Reed, and if I had a copy, I'd hold it up for you, but Labor Induction, Why, When, and How by Hency Goer. Okay, so now that I have basically showed you through story how induction can sabotage natural birth and undermine confidence and lead to moms making choices they otherwise wouldn't have made, and also told you about how labor induction can sabotage your natural birth process, can undermine your confidence, and lead to unnecessary interventions, and you know a little bit about when to make a decision around induction, that it can be positive. I've shared some resources with you. It's time to apply the empowered birth method. So as you know, we aim for a true natural birth and we pull back only as much as needed. And the time to make plans around induction is not at the end of your pregnancy. In fact, if you are before 35 weeks, you probably want to start thinking about induction now. Start making your plans because, you know, things do happen. You don't know. You might develop cholestasis or preeclampsia. You might end up recognizing that induction is right for you. And if that's the case, you don't need to be frantically in the mom groups trying to find those positive induction stories. Instead, it's going to be much more empowering for you to have your induction plan. And not only that, the medical system really pushes induction, especially around induction season. I can't guarantee that your care provider is going to be okay with you going past a certain date on the calendar, especially if they happen to have one of the 4 categories of fear or they're a category 5. Go check out some of my other videos where I talk about care providers. But what you really need to do after aiming for a true natural birth you've got to create your backup plans. And the more backup plans you have around induction and knowing what your red flags are, that you'd be like, okay, I need to have this induction. Your pink flags, I might need to consider induction. And your hard lines in the sand, oh, I'm not inducing for that. Nice try, though. The more you have that solidly figured out, the stronger your mindset is going to be. We can't ignore that we are in an induction epidemic. We can't ignore that a lot of care providers feel pressure from the insurance companies and from administration to induce their clients or to offer induction or to push induction. We cannot pretend that a lot of moms are not being scared and pushed into these things and traumatized, and then they think that induction was better than what might possibly maybe have happened, and they imagine these scenarios where their baby would have died if they didn't induce, when really it could have been that the induction caused all of those complications. So you need to recognize creating your backup plan is part of the right mindset. The other part is you need to get past your fears, okay? You need to write down all of those fears of what you don't want if you were to induce or if you were not to induce. I do have a decision-making workbook that you can download if you go and get the Empowered Birth Toolkit, or if you go and get my course, Your Empowered Birth Workshop, because it is in there as well. This decision-making framework and workbook basically allows you to gather up all of the information on induction and then make a logical decision that's also incorporating your emotions, your values, and what is truly going to be best for you so that you don't get stuck into that fear trap. So you definitely need to have those fears handled. And the reason you need to have those fears handled is because a lot of education on induction contradicts itself. So you need to have the right education on that. And that's not just going and getting induction resources. You also need to have context in this case because, you know, there are a lot of studies that get done, but these studies have problems in them. One is that the moms that agree to be in these induction studies, they don't mind being randomly assigned. And there's a lot of women that are offered the same opportunity to be part of the study, and they opt out. In fact, it can be as high as 60% of women that are like, I'm not being part of that. I don't want somebody to randomly, arbitrarily pick my due date and push me through the system and induce my labor. There's no way I'm going to be part of that. And they drop out. Then there's the moms that, for whatever reason, they develop complications. They were meant to wait until labor started, but they need to induce. They are now no longer part of that body of research. They had to be induced. And then that's going to skew the data. And then not only that, but then there's the moms that they go into labor before their scheduled induction. You can't actually do accurate studies with induction. But what you can do is pay attention to the patterns within society. I mean, if C-section rates keep rising and induction rates rise with that, then you can kind of figure out where we're going and why it's doing that. Because when you don't induce, you're less likely to have that C-section in the first place. You're less likely to need the epidural, and you're less likely to have complications with a physiological birth. But we're also looking at natural birth and then trying to compare that with induction. And we can't do that either, because natural birth still has interventions in it. There's very few studies being done with moms of physiological birth versus induction. And the reason, again, is because they would not want to be part of that study. So understanding that context, first of all. Then you also need to understand the context of physiological birth. And as I said, I gave you a little bit. If you want to know the full breakdown, I suggest you check out Rachel Reed's other book, Reclaiming Childbirth as a Rite of Passage. There's also a lot of unassisted childbirth books out there. Even if you're not planning to go unassisted, it may be worth it for you to check that out because they have a different model. They are assessing for different risks. How risky is it to stay home with a complication. Because they are not part of the medical model, they are also able to do things that the medical system is less likely to do. So then you get a different perspective on it. Because if you're only going by what the medical system says, we are also running into this issue where profit, convenience, liability, and category fives who are just like, if I induce her and she ends up with a C-section, well, I get paid either way. And I guarantee that they go into labor on my day that I'm there, so I get paid. Sorry, it's the way it is. There are actually doctors that are speaking out about this, and I have been following those ones because I like the whistleblowers in the system. We need them. So you need to have that right education. The right environment is also very important, especially if you are choosing induction. You are going to need more time to let labor unfold if you are having an induction. You are going to need more patience. You do not want somebody to be like, oh, well, we induced you, but things aren't progressing, so we're going to up your Pitocin. If you and baby are still doing fine, there's no reason to have to speed up your labor. In fact, that could end up causing problems and making things worse for you. You're in labor, and if it doesn't work out and you decide that you want to try again in a few days, you can still go home up to a certain point. So you need to recognize that the hospital that you choose cannot be an induction happy hospital where they induce everybody. And they also have a very high C-section rate because they just give C-sections to everybody and they just give Pitocin like it's candy. And they have highly medicalized births. That is not the right environment for you for an induction when you are attempting to go as natural as you possibly can. And if you're trying to go unmedicated, you need to have people that are in that environment that are not stressing you out, because cortisol and adrenaline is going to cause more pain. And depending on the induction method you use, if you're not using Pitocin right away, then you still have your oxytocin receptors. There's the Foley bulb, there's prostaglandins. That's not going to cause as much problems. You could do membrane sweep. You could even try to do natural methods like castor oil. All of these are lower level ways of inducing your labor before going for the big guns. So what I would suggest is that if you are thinking induction, go at the smallest level and keep building up gradually. Don't go right for the hammer if you don't need that and you just need a screwdriver. The other thing is you need the right facilitators. First of all, if you do not have a care provider who respects the physiological process and allows their clients to go into spontaneous labor because they recognize that's actually the best bet for them, then that's probably an induction happy care provider that's going to say everything under the sun to try to get you to induce. And those people do exist, and they can and will use your fears against you and use your partner's fears against you and try to make it sound like you have no choice. They are category fives. You need to get rid of them. You are more likely to succeed in saying no to induction if you follow what I recommend within the birth advocacy report by teaching you about the 4 categories of fear. This is how Jenny was able to get her care provider to not push induction on her, despite the fact that she had several risk factors. Because Jenny brought in her birth plan at the beginning of her pregnancy, and she said, I won't be inducing unless something of an issue happens. And her care provider was very concerned, and she addressed the fears, and she's like, I have a backup plan for induction of how I'd want that to go. So if you have your backup plan to show, it's like, I'm not saying no induction in any case, even if it's like life or death situation. Like, no, like we'll talk about that. And let's talk about this when nothing is really happening. So it's not frightening. And this is just a hypothetical situation. The more time you have with your care provider to talk about the hypothetical situations and use your appointments not just to check on your baby, but to really get a feel for who your care provider is and if you can really work with them, or if they are a category 5 who prefers you to just follow their lead, then what this does is it allows you to stay in your power. And again, the birth advocacy report is both inside of the Empowered Birth Toolkit, and it's also inside of your Empowered Birth Workshop. So lastly, you need to have the right support. You know, induction is not easy, and saying no to an induction is not always easy. So you need to have a very strong support system around you. And if your family and friends aren't supportive, you need to build that support elsewhere. This is why a lot of my clients end up hiring me, because I'm the one who's standing with them and reassuring the partner, and then also reassuring mom, and then pointing out where their family and friends are missing it so that they're like, well, my mom says this, or my friend says this, or the mom group said this, and my care provider said this. I'm like, yeah, but do you feel that there's anything wrong? And they're like, no. I'm like, okay. So this is what they're dealing with. What are you going to do? How are you going to set these boundaries in place with your family? Because obviously they are trying to mess with your mindset here, and it's not okay. And you have a right to protect yourself. And the same thing with your partner. Your partner can't be pushing you into an induction. Your partner can't be trying to get things moving when you need more time. And your partner needs to be able to hold that space, recognizing that these contractions, if you are inducing, are going to be more painful and you're going to need more from them in order to get through it. So you need to have that right support. Finally, let's talk a little bit about going deeper with the empowered birth method, because I do have a lot of resources on induction. The first one I'm going to suggest is that if you are at the start of your pregnancy trying to conceive, or if you've had a traumatic induction before and you know you don't want that again, and you're not yet pregnant, but you're thinking maybe I might have another one to reclaim my birth, then get a copy of your empowered birth, or watch the videos and do the exercises. Because if you are doing the journal exercises on this, what this is going to help you do is optimize those 5 pillars. The more you optimize, the more you're going to be able to create that true natural birth plan, your vision, and then have your backup plans. This is how Jenny did it. This is how my clients do it, is they have that vision and that backup plan, and then they have those 5 pillars optimized. The next thing that you're going to want to do is get the Reset Your Mindset for Empowered Birth mini challenge. This is going to help you uproot any of those old fears and misconceptions about birth that you might have, anything that might be sabotaging you secretly, so that you can now confidently come to your birth. And finally, your Empowered Birth Workshop. This is basically my signature program. It is completely free self-study. You can also opt into self-study VIP, which allows us to look over your homework, myself and my team members. And then you also are getting one laser coaching call. It's complimentary. It's part of what you're paying for. It's 15 minutes, and we would basically look over your workbook in advance, have an idea of what you would use that call for, because you would tell us in advance once we booked it for you. And then we would basically go over that and help you get out of any fear, or give you the map to get your care provider on board, or how to safely extract yourself from a category 5 care provider, how to get the hospital to support you, how to maybe get your partner to support you, whatever it is you need. That's what you use that laser coaching call for. And then in addition to that, you also get like extra resources. Now, the reason why I suggest you get your Empowered Birth Workshop, aside from the fact that this is the signature program and it will help you utilize all of the things that you need to know about the Empowered Birth method, it is like the overview, the baseline, concrete information that is most likely going to help you. All of the moms who went through the Empowered Birth Workshop, even at the lower level when I was teaching in the Facebook group, they all went on to have more empowered births. They made decisions on their care. They were their own best expert. They chose home birth. They chose VBAC. They chose to just basically go to the hospital at the last minute. Some of them gave birth in their car. Some of them had risk factors and they still decided to have a more natural birth. And this is because the way that your Empowered Birth Workshop is designed is to get you out of those fears, help you understand more about physiological birth. There's a module on that. Then you also have a module on induction traps. Avoiding the induction trap is module 3. And it also comes with the guide that tells you how to avoid the induction traps. So you're going to want to check that out if you don't have it already. But, I also have lots of videos within the do-it-yourself path on induction, so you can go and look for those. And if you have any questions, you can always reach out to me and my team. hello@empoweringmomsbirth.com. Okay, so now you know more about how to go deeper with empowering moms. Now I'm going to tell you very briefly about the 3 paths. You have basically been doing the do-it-yourself path on these master classes. All you have to do is keep following this channel, like, share, subscribe. Please pay it forward, pass it on, comment as well, because if you're commenting, that's going to boost the algorithm. That's going to allow us to be seen. And if we're seen by more moms, then we can change things and have moms be able to come to their birth from a place of power instead of fear. Because I'm really tired of seeing this induction epidemic. Moms don't deserve this. And the way that the medical system just keeps increasing the induction rate every year, it's a problem. And the way to change a system is to inform the consumer. So I am informing the consumer. So the next thing, though, is if you like more structure, then you're going to want to do the self-study path. Now, I do have the workbooks inside of the Empowered Birth Toolkit. My book is technically self-study, and your Empowered Birth Workshop, as well as any of my other mini courses and deeper programs, are part of the self-study path. Not every single course that I have is self-study. The reason for that is because they are very dense. There is a course I have called Your Empowered Birth Academy. It is for the moms who basically want to do this themselves. If you are a mom who's like, that's it, I want a free birth and I don't know where to start with the information, I'm still a little scared, but at the same time, the thought of going into the hospital if I don't need to is terrifying, and they're pushing induction on me, and I really need to be able to do this. I need to be able to create my backup plans, and I need to be able to take my power back. If that's where you're at, then I'm going to suggest you need to go through your Empowered Birth Workshop at least 3 times before you tackle Academy. Because if you don't do that, it might just be too overwhelming for you. There's a lot inside of Academy. This is basically me coaching you without me coaching you. The other thing with Academy is it is a self-study VIP course. And the reason, again, is because if you are stuck, you need to reach out for help. And we are going to be checking in on you to make sure that you have what you need. So within that self-study VIP path for Academy, you're basically getting access to the team and to me. You also get a deeper level laser coaching call. However, this one is longer than 15 minutes because we are really going to go deep. We're going to make sure that you get your empowered birth because I'm committed to you having an empowered birth, whether you can work with me directly or not. And path number 3 is premium coaching. This is where I started out with Jenny and some of my other clients in the beginning. And I was basically sitting in class with them for 2 hours and imparting all of my wisdom before I put it into courses. I have also sat one-to-one with clients where we meet every single week for about an hour, sometimes up to 90 minutes. And I am also available on WhatsApp. So they are getting me between our sessions and they will call me after their appointments. And I have been able to basically be that support for them. I don't work with everyone who comes to me. It really has to be aligned. And I protect my time and energy, as do my coaching queens who are also working within the team. So that takes basically an intake form. Now, if you want to know more about what each of these paths entails, you can go to my website, empoweringmomsbirth.com/start guide, because I do go deeper into the details of how to get the most out of the do-it-yourself path, the self-study path, and the premium coaching path. So you can go there and you'll also get some additional resources that start you off on the right track. So now that you know about those three paths and you know more about the empowered birth method, let us quickly recap on what we learned today about the natural birth trap of induction. First of all, induction is not natural. You cannot have a true natural birth if you are doing induction. You're pushing on the outside. Now, depending on how close you were to going into labor, induction may or may not work for you. If you do not have those factors of your cervix opening or your cervix pointing towards your birth canal or your oxytocin receptors in your uterus, then nothing is going to get that baby out. It's just not going to work. It's going to sabotage you. Induction leads to more interventions. A lot of them are put in place because induction is not inherently safe. There are things that can go wrong with an induction. So you need more monitoring. You need to have the IV fluids and possibly an open vein because you're more likely to hemorrhage if you have an induction, particularly if you're using Pitocin, which is one of the most common ways of inducing labor. It is sabotaging your physiological birth process completely, because your baby is no longer able to signal to your uterus that contraction was too hard. If they break your waters during this induction, baby can't get into a good position. The uterus is now squeezing on baby even more. This can also cause more labor pains, and this can cause you to have your baby go into distress. This is not a gentle process. If you want to know more resources, I do encourage you to check out Hensi Goer's book, Labor Induction, Why, When, and How, and Rachel Reed's book, Why Induction Matters. This is probably the best education I can give you on induction. So take advantage of those resources. And finally, I also wanted to mention that sometimes induction is warranted and you deserve to go in with all of the facts and all of the education. And the best way is to do that before you even get to 35 weeks. You really don't know what's going to happen. But if you wait until the last minute, thinking that you're just going to have a completely natural birth and you haven't thought ahead of how the medical system may push you into an induction, and you think that the option is just, well, I'm just going to refuse, without doing the work internally of thinking of all of the fears that they may bring up, this can derail your birth and undermine your confidence. So you really do want to dial in this empowered birth method, especially when induction is concerned. This is one of the things that I am mostly combating with the empowered birth method, because what I noticed is that no matter how much information was dropped for moms, no matter how many times evidence-based birth articles were dropped, no matter how many times midwife thinking articles were dropped, no matter how much research, no matter how many stories of moms who don't do it were dropped, a lot of moms would still end up being too afraid to say no to their care provider. And you need to get past that in order to have your birth your way. Otherwise, you're going to fall into those fear traps. You need to come to your birth from a place of power instead of a place of fear. And that is why I'm just going to ask again, if you found value in this video, please like, share, subscribe to our channel, pay it forward, pass this on. when moms are talking about induction in the mom groups, drop this video, because that is the video that is going to wake them up and have them realize that they can be empowered moms too. Even if they never work with me or get my book, I want this information out there. A drop in the ocean creates ripples. Many ripples create waves, and enough waves can change the tide. If we can change the tide, if we can create more options for moms, if moms are no longer in their fear, they are able to have that true informed consent. The care providers that truly want to support these moms, but for whatever reason, they have their hands tied, they will no longer have their hands tied. And the category 5s will be thrown out, change, or get out of maternity care. And finally, this will also allow moms to no longer risk out of home birth just for things like going overdue, or being told that they have a big baby, or being told they have a small baby. Instead, moms will be able to come to their decisions, and they will be able to make the right choice for them, so that they're not later looking back, finding the information, being like, if I had only known this, I never would have gone for that induction. You know, I was really lucky. I was incredibly lucky that I am so stubborn that I dug my heels in and refused to induce. But what if I hadn't? What if I had been in that space of I can't say no to anybody, and I can't find these loopholes in the system, and I guess I need to just do what's best for my baby? If I had been plagued by mommy martyr syndrome, and I wasn't rejecting anything of like, don't tell me what to do, like if that was my path, I guarantee I probably would have had a C-section, and my baby would, like, something might have gone wrong with that. So recognizing that induction is not one size fits all. If Christine had been told at 39 weeks that she needed to induce, I told you, at 42 weeks, her baby was 6 pounds. If Christine had been pushed into an induction at 39 weeks, as is most common for first-time moms now, what would that have done to her baby? He would have been way, way too tiny. He wasn't ready. He was barely ready at 42 weeks. She probably had a couple more days to go before he was ready. And you need to understand that we can't keep rushing this process just to fit some arbitrary timeline. It doesn't work. You need to go into labor in your own time and create your backup plans only if you need them, and draw your hard lines in the sand. So that is what I have for you today. Thank you so much for watching. Again, if you found value in this video, please like, share, subscribe, comment, pay it forward. If you comment into the actual videos, then what happens is this boosts the algorithm. I do read all of my comments. I love it when I see comments. I may not get back to you right away. So if you do have an urgent question, your path is to either email the team, hello@empoweringmomsbirth.com, or if you are a newsletter subscriber, you just hit reply to any one of our emails. And, you know, the other thing is, if you are taking the self-study or self-study VIP path, then you can just reply to those emails, because you automatically get the newsletter as well to enhance your education. And, you know, premium coaching clients, they just hit me up on WhatsApp because they have access to me there, or they have access to the group chat. So it all depends on the deeper layers of access, and information is free. I only charge for access to me and my team. So recognizing that, now we are at the end. Thank you so much for watching. Next week, we are going to tackle another natural birth trap, staying in bed. So you're going to want to stay tuned for that, because I have more stories in the Empowered Birth series, and I am going to teach you everything you need to know to plan and get your empowered true natural birth, because every birth can and should be a beautiful and empowering experience, no matter what. No more excuses. And when you have an empowered birth, you're an empowered mom for life. so no one can take your power away from you ever again. So thank you again. Have a happy, empowered birth journey. Whether you're birthing a baby, birthing a business, birthing a creative project, a movement, or you are rebirthing a new version of yourself, Empowering Moms is here for you. Thank you so much for watching, and I will see you next week. Namaste.